Hi, I'm Dr. Elizabeth Murray. I'm a pediatrician at Golisano Children's Hospital, and it is April 10th. We are in the midst of the COVID-19 epidemic, and we are doing our videos a little bit differently because we need to make sure that we're maintaining physical distancing as much as possible. So my clinical responsibilities have ended for the day, even though I was a couple of hours ago right down the hallway from the guest we're about to speak with. We needed to do these videos apart. So I'd like to introduce you to Sarah White-Smith from the Bivona Child Advocacy Center. If you would, just quick 2 seconds about your job there and the role of Bivona in our community.
Awesome. Thank you so much, Elizabeth, for having me. So my name is Sarah White-Smith. I am the multidisciplinary team coordinator here at Bivona Child Advocacy Center. We have been in the Rochester area now for just under 20 years, about 15, 16 years, somewhere along in there. So we're in that teen stage. So Bivona is a group of professionals that come together from law enforcement, from Child Protective Services, folks from Golisano Children's Hospital, like yourself, Dr. Murray, and we work with quite a few of the mental health providers throughout the city of Rochester and Monroe County. So the team comes together really to investigate and treat and work with the children and families who have been the victims of child sexual abuse, severe and severe physical abuse. And then also we work along with a lot of the families where there are child fatalities, and also children when they are witnesses to violent crimes.
So April actually is Child Abuse and Prevention Month anyways, but obviously we're all feeling it a little bit different right now. I think anybody
Absolutely.
in this world of child abuse medicine is really worried about what's happening because of the isolation, because of the lack of the safety nets, because teachers aren't with the kids as much as they used to be, and certainly all of the tremendous stress on every adult and kids for that matter because of what we're living through right now. So the concept of a child advocacy center is a national model. So if somebody from elsewhere is listening to this, you can just Google child advocacy center in your city to get information. But here locally, if a person is concerned about a neighbor, if they need advice, if they're concerned about their own child, there is a number that at our local center that people can call and get help. Can you talk to me a little bit about that if you could?
Absolutely. So even though we are living and working under the restrictions of the COVID-19 pandemic that's currently going on, Bivona is still here. We have a much smaller staff here in the building now, working along with the CDC and Governor Cuomo's recommendations that we limit the number of people that we have in the building. But we are here Monday through Friday, 8:30 to 5. We are available for families if you need help, if there is a child that you are concerned about, and maybe you just think you might need a little bit of information on what you should do, some ideas, or who do you call, certainly pick up the phone and call Bivona. Our number here is 585-935-7800. We do have folks here working, again, Monday through Friday, 8:30 to 5, professionals who can answer those questions or just maybe kind of give you some ideas of what you can do to possibly help a child who might be the victim of abuse. I know that sometimes we just get phone calls where professionals and just people throughout the community, they just have a question. They've seen something, they've heard something, and they're concerned about a child, and so they call and we're able to give some type of guidance and direction to them.
And if somebody is concerned, those calls can come in anonymously, I believe, if need be. Is that correct?
Absolutely.
Okay.
Absolutely.
Yeah,
Absolutely.
and so, and the outcome of those phone calls can be a variety of different things. So Bivona offers a variety of therapy services, which are happening via telemedicine right now.
Yes. Yes.
The decision might be a recommendation to call 911 or, the local police department, child protective services, the child's pediatrician or family practice doc. So there could be a lot of different outcomes.
Yes.
With regards to the telemedicine component of it, what kind of things are you guys still able to do over the phone or over video conferences?
So we have our mental health department that consists of 3 folks that actually work for Bivona, but then there's also several partner agencies that we work with, including Catholic Family, SPCC, and also Villa of Hope. So right now we've moved to the teletherapy model, if you will, pretty much 100%, as well as another partner agency we have is LOSATS, Linden Oaks. So everybody has moved to that model. And I think that just from reports that we've received, it's been well received. I think one of the great things is it gives the therapist a chance to see the child in their own home, in their own natural surroundings. Kids are kind of excited to show you the room, or, you know, this is my little brother, or this is, you know, this is my favorite place in the house, or, and so I think it kind of gives them a whole new perspective on working with the families, which is great.
Yeah, I think that is a tremendous insight, and I think pediatricians are feeling that as well with the telemedicine component coming online. To really see children in their own environment is a nice
Absolutely.
thing. Um, we were asking teachers to do the best they can to check in with kids that they were maybe worried about before all of this started, but we certainly understand, again, that the safety nets for many children have been lost. We know that in general, calls to CPS, about 20% of them are from teachers. Another very large percentage is from medical providers, and we know that some of that stuff is slipping by. As far as parents talking to their kids, I think you know, it's an interesting opportunity because we have so many kids online now and so much access to stuff that maybe they hadn't before. You know, are there concerns about inappropriate interactions with adults online that maybe we hadn't faced before? What do you think?
So I think that we're living in unprecedented times. First of all, let's just start with that. And we know that our lives, for the most part, have moved to online. Everything is being done online. We're educating online. We're doing our therapy online. We're calling our friends. There's more socialization going on online. We're Zooming. We're FaceTiming. So I think that one of the things that families, parents especially, need to remember is they have to still, even it's difficult, but you still have to set up some type of a plan with your child, and it has to be a deliberate plan. I think one of the great things that we have on our website, Bivona, BIVONACAC.org. We have a lot of different resources that families can utilize. We have on there, in fact, one of the resources that I really like is it's a media plan.
Yeah.
And it's under our D2L, Darkness to Light link. If you click on that, it'll take you through how you developed an actual media plan for your children and your families. And it's a great tool for families to use. I think one of the other things is parents, we've got to kind of think outside of the box as when it comes to educating, because at this point we're educating, we're eating, we're doing everything all in that same little area. So we got to kind of think outside of the box. I know one of the ideas that my son did, and I was trying to get my son to do it, is take some paper and put it on the wall, tape up a whole wall, and just let the kids color the wall. Wow, you get to write on the wall, and right, and you're not actually ruining my walls. Or for older children, I think a great thing to do is to start doing some video journaling. So you can actually kind of talk through some of these emotions and these feelings, because there's so much going on. Kids they're used to having that time away from mom and dad at school, and they don't have that right now. So we got to kind of think of ways to still keep them connected to their friends, but also keep them protected online.
Yeah, and as parents, we have to remember that we can take a timeout too. That we talk about giving our toddlers
Absolutely.
timeouts, but we need them too, because we can all reach our boiling
Absolutely.
point, even where it's never happened before. Again, just so much togetherness sounds nice, but it can be really challenging with a
It's
temperamental
tough.
3-year-old or
It's
just
tough.
too much going on. And so it's okay for us to say, I've reached it. I'm at my limit. I need to step
Yeah.
away for a few minutes.
Yeah. Yeah.
And that's an okay thing to do. Understand what you're feeling and what you're going through as a parent is very different than your expectations of how life was going to be. And
Absolutely.
understandably incredibly stressful. And so we all have to help each other out.
Yeah. Yeah. And I think that it's important too that you explain to your children, I got to take a time out. Like, I need a break right now. So I'm going to go downstairs in the den, and you're going to stay upstairs, and we're just going to take a break from each other. Because what we're seeing here is an increase in the number of physical abuse cases. And that's a direct, those two are directly related.
Right.
You're home 24/7, kids are home 24/7. It's human nature that eventually somebody is just going to say, I've had enough. And it's what we do with that anxiety and that anger and those emotions that counts after that. So.
All right. So, kind of in summary, Bivona Child Advocacy Center remains open. It is 100% an essential service and is available 935-7800 during normal business hours would be the number to call.
Absolutely.
If something is dangerous happening, certainly 911 always remains available.
Absolutely.
The Child Protective
Absolutely.
Service hotline is still
Yes.
available, and those investigations most definitely are still continuing. And pediatricians and family practice doctors certainly remain available to help families that have questions or concerns or struggling themselves.
Absolutely. Absolutely.
All
That's
right. Did I
good
miss
here.
anything?
Nope, I think you got it all.
All right. Thank you so much for everything you're
Thanks.
doing, and thanks for joining me today.
Thank you so much for having me. Take care.